Hi, my name is Olivia Reynolds. I'm a psychotherapist with Healing Hearts Trauma, and I'm going to do the next segment on personality disorders. We're going to talk about borderline personality disorder. Sadly, borderline personality disorder is one of the most stigmatized, even though more people use narc abuse and narcissism, and they call people narcissists. They don't really talk about borderlines. And all the time when I hear people, I'm like, I bet you that's a borderline. And they just don't know it. And they call it narcissistic abuse because they're very hard to understand. All again, ridden from trauma. And so I like borderlines because most people don't. I do get very traumatized with dealing with them in therapy because they can stab you in the back really quickly. When they're wounded, talk about bunny boiler. And so getting their trust in their alliance and with them is very difficult. So I have to tread on water for a while before I give them any type of like confrontational skills because if they're in love with someone and you're trying to get them away from them, they're going to hate you because they're going to see you as like trying to take what they want, right? They like the unhealthy. And remember, their core wound is betrayal. Starts very early in life from their caregivers. Either their mom was obsessed with their men and left them often alone to play alone. Like searching around, right, for a new love. And you'll hear this often. The children were left to kind of care for themselves while she was off with her escapades, right? Sometimes the mothers would be so not even care for their children that they would let their husbands beat on their kids or whatever else. Like they're their new daddy or whatever. I can remember when my mom divorced my dad, she was completely obsessed with my sister's father, that she chased him all over the world and drug us around for her to have her little love affair with this guy, right? Meanwhile, we were like, we were a family or whatever, and she made sure we stayed close and tight with each other because, again, they have this obsession with love and whatever. And it mirrors from abandonment, right? She was abandoned. The other part of borderline personality is to know that it's systemic, too. Usually, if you have traits of it, your mother did, and her mother did, and so on and so forth. It's less common in men. So the thing about the DSM, which is nice, it also goes through like risk and prognosis. It gives you stats. It gives you like other kind of criteria just besides what you type in online. It's not as good about things. And it also gives you the differential diagnoses, which we should be looking at, because what else could it be if it's not BPD? Or do they just have traits, right? So it can be histrionic, because a lot of people think we're attention-seeking, manipulative types, rapid shifting emotions, self-destructive behaviors. They can get really angry, paranoid. There's so many antisocial personality disorder. Again, overlap, autism. If I put this up, and I've done this before, I make little circles and diagrams of BPD versus CPTSD and the overlap and the combination, because there's that much similarities in this stuff, but yet everyone's slapping around names. Personality changes due to medical conditions, substance use disorders, identity problems. And then, we look at other elements that's happened, like sexual abuse, physical abuse, being exposed to just any type of trauma can create this change in our mind. And then you can add some of this personality traits to it. So they have a lot of stigma because, again, they've been abandoned as children. The caregiver moved away from them at some point, didn't protect them, didn't make them feel safe, seen, heard, valued, and supported throughout their life. And they've developed this because I didn't have a family, and now they watch TV and they watch cartoons and they see this romanticized version of what seems like a normal family homeostasis. They want it. They don't want to feel abandoned and unneeded and not loved. And so because they have lack of parental involvement in any type of ways of their life, they tend to attract someone that seems like a parental role to them. Insert the dance with someone who's in power or in control or charge. So they make themselves real easy targets for abuse and cycled victims because they tend to date people who are, and this would make them seem like a narcissist because they looked for grandiosity or for certain things and their partner to possess, right? Because it makes them feel safe, which can be the trick when you're dating, because you're like, oh, this person offers all this stuff and they're going to love me and make me feel safe. And you're like, shit, right? It's hard to miss because sometimes we deal with sociopaths and people who are really good at also manipulation on the other side. So, it's really tricky. So here's some books I'm going to tell you really quickly because energy vampires love the love bombing from a borderline. They love the energy. They love it from an anxious attacher. They love it from an extrovert. So whatever we want to label this stuff, my goal is just to teach us to love all these labels because borderlines have the most stigmatized label, although it should be narcissist, and people love it because you hear it every time you turn on social media. Narcissist abuse. They were a narcissist. We use it because it's a relatable trait of what we know as like someone who's avoiding things and or getting supply elsewhere. Anyways, borderlines have the biggest rap because insurance people saw them as the most pervasive. The other part of borderlines is they can self-harm, right? They have self-harming behaviors, whether it is physical self-harm by suicide, cutting. Usually those are the first warning signs. Do you cut? Do you self-harm? Have you tried to commit suicide, right? If they have, then proceed on to inquire about the rest of the symptomology because that is the number one is those maladaptive self-harming because they're wounding themselves to feel some other type of pain than the emotional pain they're feeling. And that intent inside that they're over here, they don't want to feel it anymore. So they'll cut themselves deep so they can feel that wound. I've had so many patients, and sometimes you can't see their scars, cut their hips, cut their thighs with razor blades. I mean, it's not for attention. That's the biggest thing that we hear is like, oh, you're doing that for attention. You must be needy. You must need to be validated. No, they're hurting. And so it's almost a dissociation state where they'll cut themselves to relieve pain. It's another pain. Another way is tattoos addictions. It's ever heard of ink therapy, right? We do it as another way to kind of like kind of rechannel like a different part of your life and use it as a way to kind of dissociate. And I'll get into that in another segment, talking about dysregulation versus dissociation and how we use them interchangeably, because it's very important to know. So energy vampires, they want to suck the energy. Most people that are on the other side are often depressed or suffer from other mental health issues, and therefore they need someone that has that energy. This book right here is probably by far my favorite. Mothers Who Don't Love. There's actually Kim Sage is a psychologist I follow. I've read this book like 10 years ago. She does a really good job explaining this book and the 12 types of the borderline mother, the waif, the witch, the hermit. Gosh, I can't remember them all, but very interesting because we all don't look alike, right? Princess Diana actually is very successful, is a borderline personality per this book, right? She's very regal and poised in person, but she has this side of her that can switch and be quite dark, right? And not in a bad way. They can just get really angry and wounded. Set them betrayal wounds off and find out. If I've ever told you the story about the bunny boiler, which I will in the emotional dysregulated section, set them on fire and they'll show you. This is stop caretaking the borderline and the narcissist. Again, they dance so well with each other because they want what each other has. And we'll explain this in another. This is probably one of the better reads out of all these. Mothers Who Can't Love, another really good read. I Hate You, Please Don't Leave Me. It's again that push-pull. There's seconds of you I really love, but then when you really, really, really make me question whether you're loyal to me or you're messing with me, they're going to threaten to leave. Loving Someone with Borderline Personality Disorder. Splitting. Both on narcissist and borderline. And Overcoming Borderline Personality Disorder. So through the years, I've read all these books and got a lot of information out of them. And then I switched. I was like, yeah, I don't think it's this anymore. Obviously, there are a lot of relation to the maladaptive behaviors. But then I stumbled across, when I started getting my trauma training, when I was working with youth, I was like, oh my God, these people don't have personality defects. They want love and everything just like us. They just have trauma wounds that are so deep. And if we could just heal the trauma, we could give them what they need. These people are not broken. They're not uncurable. That's what insurance likes to believe about personality disorders. Like, you're stuck with this. No, you're not. Come in for part 2.